Have you ever felt a strange wave of dizziness late at night and brushed it off as just being tired? A patient of mine once told me she would wake up around 2 in the morning with a heavy feeling behind her eyes, but she didn't think much of it. I want you to imagine something for a moment. Picture yourself lying in bed in the quiet hours of the night, the house still, your breathing soft, and suddenly your body gives you a sensation you can't quite explain. Not painful, not dramatic, just different. A brief pressure, a moment of fog, a tingling you've never felt before. Most seniors tell themselves it's nothing, but often it's something worth listening to. Nighttime is one of the most dangerous windows for strokes, yet so few older adults hear this truth. We tend to think strokes happen during stressful daytime moments, but a surprising number occur between 10 p.m. and 6 a.m. when the body is quiet and unprotected. During sleep, blood pressure shifts, circulation slows, and oxygen delivery to the brain changes more than many people realize. These natural patterns can make the brain more vulnerable, especially after age 60, and the early warning signs that appear at night are almost always missed. A sudden rush of dizziness, a strange head pressure, mild numbness in the arms or fingertips, that confusion you feel when you first wake and struggle to gather your thoughts. Older adults commonly dismiss these moments as age or exhaustion, but your body doesn't whisper without reason. These are signals, not accidents. What makes nighttime even riskier is the truth doctors rarely explain. Going to bed dehydrated thickens the blood. Poor sleeping posture limits oxygen flow. Sleep apnea starves the brain of air. Heavy late-night meals raise blood pressure. And taking certain medications at the wrong time can weaken your body's natural nighttime protection. These are small habits, but together they create a greater stroke risk than most seniors ever hear about. As we age, our arteries stiffen, our circulation slows, and our respiratory muscles lose a bit of their strength. Hormones shift overnight, and the body moves less while peeing, allowing tiny problems to grow quietly. In this video, we're going to talk openly about the nighttime mistakes most seniors never think twice about, the early signs that deserve attention, how nighttime circulation truly works, and the simple routines that can protect your brain and your independence. You deserve to feel safe in your own home, even in the quiet hours of the night. If you find this helpful, I invite you to stay with me and subscribe to Senior Health Daily so we can keep learning and protecting your wellness together. The science behind nighttime stroke risk. When we talk about nighttime health risks, most seniors are surprised to hear that the quietest hours of the night can be the most dangerous. Between 2 and 4 in the morning, the body goes through natural physiological shifts that most people never feel or understand. Your blood pressure rises as your brain prepares for waking. Hormonal changes increase circulation demands. And for older adults, these shifts can become overwhelming. As we age, dehydration becomes a much bigger problem. After 7 or 8 hours without water, the blood thickens slightly. That thicker consistency makes it harder to move smoothly through the blood vessels and increases the likelihood of clotting. This is why strokes often develop or worsen in the early morning hours. The body is trying to push thicker blood through narrower arteries, and the effort sometimes becomes too much. Sleep apnea and shallow breathing also play larger roles than most seniors imagine. When breathing becomes irregular or stops briefly, oxygen supply to the brain drops. For younger adults, the body usually compensates quickly, but after 60, with stiffer arteries and reduced elasticity, the brain struggles to receive enough oxygen during these pauses. This makes the brain more vulnerable to strokes, especially when combined with morning blood pressure spikes. Circulation slows dramatically at night. Muscles are relaxed, body temperature drops, and blood tends to settle in the lower extremities. If someone already has issues with blood flow, this slow circulation allows small clots to form or allows existing ones to travel more easily. A clot that starts in the leg can reach the brain faster at night than during the daytime. I recall one patient, a gentlewoman in her 70s, who began noticing tingling in her left hand each night before bed. She assumed it was arthritis or poor sleeping posture, but 2 weeks later, she experienced a mini stroke that affected her speech for a short time. Looking back, she told me she wished she had taken those nighttime tingles more seriously. They were her body's first whisper that something wasn't right. Nighttime stroke biology is deeply connected to hydration, oxygen levels, blood pressure fluctuations, and circulation quality. The more we understand it, the more power we gain to protect ourselves. Nighttime habits that increase stroke risk. Let's talk about the habits many seniors don't realize are silently increasing their risk as soon as the sun goes down. These habits aren't dramatic or intentional. They happen in the quiet routines of everyday evenings, yet they shape the body's most vulnerable hours. One of the biggest nighttime mistakes is sleeping flat on your back. It seems harmless, even comfortable. But for many older adults, this position collapses the airway slightly, reducing oxygen intake throughout the night. When oxygen drops, the brain is forced to work harder to maintain normal function. Over time, this mild strain increases the risk of nighttime stroke events. I often suggest elevating the upper body just a little, and many seniors are shocked by how much easier they breathe when they do. Another habit I see often is going to bed dehydrated. Seniors drink less water than they think they do. Some are afraid of waking to use the restroom. Others simply don't feel thirsty at night. But dehydration thickens the blood, increasing its viscosity and making it harder to circulate. Thick blood is more likely to create clots, especially in the early hours of the morning. Just a half cup of water before bed makes a profound difference. Then there's the late-night heavy meal. When seniors eat salty, fatty, or heavy foods at night, the digestive system works overtime. Blood pressure rises. Inflammation increases. The heart and brain receive less oxygen-rich blood as digestion steals the spotlight. Many seniors I've treated experienced nighttime head pressure or morning brain fog simply because of what they ate a few hours before sleep. Long sitting periods before bed also raise stroke risk. When you sit for a long time after dinner or during evening TV time, circulation slows even more. Blood pools in the legs and feet, making it harder for the heart to push blood upward. This slow circulation sets the stage for nighttime clot formation. Medication timing is another hidden trigger. Many blood pressure medications work better at night, not in the morning, yet many seniors mistakenly take them with breakfast. Others take blood thinners too early in the day, leaving their bodies less protected during vulnerable nighttime hours. This is why discussing medication timing with a physician can literally change stroke risk overnight. Stress and overthinking before bed create another hidden danger. When the mind becomes anxious at night, cortisol surges. Cortisol increases blood pressure and heart workload, and in older adults, the nighttime cortisol peak happens faster and hits harder. Some seniors don't realize that their late-night worrying is raising stroke risk more than daytime stress ever could. Even the temperature of your bedroom matters. Sleeping in a cold room constricts blood vessels, which raises blood pressure. Seniors who already have stiff arteries may unknowingly put strain on their hearts simply by keeping their bedroom too cold. Each of these habits seems small, but together they create the perfect storm. Silent stroke warning signs. During the night, most strokes do not begin with dramatic collapse or sudden speech loss. They begin with quiet whispers during the night. Seniors often miss these signals because they appear soft, subtle, and easy to explain away. One of the earliest warning signs is sudden head pressure. Many older adults describe it as a helmet feeling, as if something is gently tightening around the top of the head. This sensation comes from reduced blood flow to the brain and is often a sign that the brain is struggling to receive enough oxygen. One-sided tingling or numbness is another warning. If your arm, hand, or leg feels slightly heavier or numb when you're lying in bed or upon first waking, it may be more than a sleeping position issue. It could be reduced circulation to one side of the brain, difficulty speaking or thinking clearly. When first waking is also a red flag. Many seniors tell me they feel foggy or slow to think in the morning. When this becomes unusual or more noticeable, it may indicate a temporary drop in blood flow to the brain during the night. Vision changes, such as blurry vision or double vision, when you first open your eyes, are signals that the brain's visual centers may not be receiving adequate oxygen. Brief episodes of confusion or irritability during the night or early morning are often misinterpreted as sleepiness or fatigue, but they may actually be signs of mini strokes. The challenge is that seniors are often conditioned to dismiss these episodes. They tell themselves it's aging or dehydration or poor sleep. But the truth is that the brain rarely sends new sensations without purpose. These warnings are invitations to act before something more serious happens. Health conditions that make nighttime riskier. Certain medical conditions dramatically increase the risks older adults face at night. Understanding how these conditions influence nighttime blood flow helps seniors take back control of their health. Uncontrolled blood pressure is the #1 risk factor for stroke. Blood pressure naturally rises during the early morning hours, and if your baseline pressure is already high, this spike becomes dangerous. Many seniors experience nighttime surges without knowing it. Atrial fibrillation is another major risk factor. Irregular heartbeats allow blood to pool in the heart's chambers, increasing the risk of clot formation. These clots often travel to the brain during the early hours of the night. Diabetes affects the body's ability to regulate blood sugar, and unstable blood sugar can weaken blood vessels. High sugar levels thicken the blood. Low sugar levels reduce oxygen to the brain. Both conditions increase nighttime stroke risk. High cholesterol narrows blood vessels, creating rough surfaces where clots can form. During the night, when circulation slows, this narrowing becomes even more impactful. Carotid artery narrowing reduces blood flow to the brain. Many seniors with mild narrowing don't know they have it, yet this condition becomes more dangerous when blood pressure rises in the early morning hours. Chronic inflammation contributes significantly to clot formation and vessel damage. This inflammation can come from arthritis, autoimmune disorders, or long-term stress. Sleep apnea remains one of the most significant nighttime stroke risks. Repeated pauses in breathing starve the brain of oxygen. After 60, the brain becomes more sensitive to every dip, making sleep apnea a powerful trigger for nighttime strokes. Each of these conditions plays a role in how vulnerable the brain becomes during sleep, but when seniors understand these risks, they gain the power to intervene. Other hidden nighttime triggers seniors don't notice. There are smaller nighttime triggers many older adults overlook entirely. Several seniors develop swelling in the legs and feet during the day. When they lie down, this pooled fluid moves upward and increases strain on the heart. Elevating the legs before bed reduces this burden, but many seniors don't think to do it. Sleeping with poor pillow alignment strains the neck. When the neck is strained, blood flow through the carotid arteries can become restricted. This reduces oxygen to the brain and increases the risk of nighttime stroke events. Tight sleepwear can restrict blood flow. It sounds minor, but even slight pressure around the waist or legs can influence circulation in older adults. Long periods of stillness during the night also raise stroke risk. Seniors often sleep deeply and move very little, allowing blood to stagnate in the lower body. Low magnesium or potassium levels before bed can trigger nighttime palpitations and blood pressure spikes, both precursors to stroke. Irregular sleep schedules disrupt the body's natural hormone patterns. For older adults, these disruptions intensify morning blood pressure surges and make the brain more vulnerable to oxygen changes. Each of these hidden triggers can be reduced with simple adjustments once seniors recognize them. Supplements that support nighttime brain and vascular health. Supplementation can support nighttime circulation, help regulate blood pressure, and lower inflammation when used safely and intentionally. Omega-3 fatty acids reduce inflammation and make blood less likely to clot. Many seniors who begin taking omega-3 notice improved mental clarity and fewer morning headaches. Magnesium glycinate is one of my favorite recommendations. It relaxes blood vessels, stabilizes nighttime blood pressure, and helps calm the nervous system. Many seniors sleep better with magnesium and feel more balanced when they wake. CoQ10 supports the heart's energy production. Seniors who take CoQ10 often report fewer palpitations and better endurance during the day. Vitamin D3 combined with K2 improves vascular flexibility, allowing blood to move more smoothly and reducing risk during nighttime pressure spikes. Turmeric or curcumin lowers chronic inflammation, which in turn lowers clot risk. Seniors with arthritis often appreciate this supplement for dual benefits. Electrolyte balance before bed helps prevent dehydration. Many older adults drink too little water at night, and a small amount of electrolytes can help maintain hydration without causing frequent nighttime bathroom trips. I've seen many seniors improve their nighttime comfort and reduce warning symptoms simply by using these supplements responsibly. Nighttime routines that protect the brain. Healthy nighttime routines act as protective armor for the brain. These routines do not require dramatic lifestyle changes. Instead, they thrive on small, consistent habits. Drinking half a cup of water before bed keeps blood from thickening too much overnight. Seniors who try this often feel more mentally clear in the morning. Sitting on the edge of the bed for a full minute before standing prevents sudden drops in blood pressure. Many nighttime falls and dizziness episodes happen simply because someone stood up too quickly. Gentle neck stretches help open the carotid arteries and improve blood flow to the brain. These movements take only a few seconds, but create noticeable differences in oxygen flow. Using a slightly elevated pillow supports airflow and reduces nighttime oxygen dips. Seniors with mild sleep apnea often feel more rested with this simple adjustment. Light leg movements before bed stimulate circulation. Even a few ankle pumps help prevent blood from pooling overnight. Avoiding screens and heavy thinking before bed calms the nervous system. When the mind is peaceful, nighttime cortisol decreases, reducing the risk of blood pressure spikes. Maintaining a warm, comfortable room temperature keeps blood vessels open and circulation steady. Seniors often don't realize how much cold air affects their blood pressure. These small steps, practiced consistently, offer powerful protection when symptoms become emergencies. Despite all precautions, some symptoms signal immediate danger. These symptoms should never be ignored, especially at night. Sudden weakness in the face, arm, or leg is a classic emergency sign. If this sensation happens at night or upon waking, immediate help is essential. Trouble speaking or forming words, even briefly, means a part of the brain is struggling. A severe headache that strikes suddenly in the night is an emergency until proven otherwise. Sudden loss of vision or extreme dizziness indicates reduced blood flow to the brain. Loss of balance or sudden confusion that happens out of nowhere must be taken seriously. Responding early saves brain cells and preserves independence. I always remind my patients that seeking help quickly is not overreacting. It's protecting the life you've worked so hard to build. As we come to the end of our time together, I want you to take a deep breath and let something settle gently in your heart. The nighttime symptoms you may have felt are not punishments. They are not signs that your body is failing you. They are messages, quiet and honest, asking you to pause, to listen, and to care for yourself with a little more intention. You are not helpless in this journey, and you certainly are not alone. I am here, and so many others are walking this path with you. Your brain and your heart have carried you through so many seasons of life. They have held your memories, your choices, your dreams, and your love. Every laugh you have shared and every challenge you have overcome is written into the fibers of your body. Caring for yourself at night is not a burden. It is an act of honoring the incredible story you have lived. And here is the truth. I want you to remember, small nighttime habits can change everything. A sip of water before bed, a slow rise from your pillow, a kinder sleep posture, a quiet moment to breathe. These choices protect you more than you realize. Awareness is a form of strength. Each tiny action becomes a shield between you and danger. There is so much hope for you. Even at 60, 70, 80, or beyond, your brain remains beautifully adaptable. It listens, it responds, it heals. Your future health is not fixed. You can shape it, one gentle choice at a time. Your brain is still listening. Every choice you make tonight protects your tomorrow. If this message has helped you, I invite you to stay close, stay informed, and subscribe to Senior Health Daily so I can continue guiding you with warmth, clarity, and care every single week. You deserve nothing less.